Welcome to my channel, A1C, high blood sugar as it relates to diabetes. I started this channel because of I hate to use the word anger, but I guess a better word might be disappointment in the primary care physicians that I had in the past that told me that my blood sugar was too high or was high. A lot of times they would prescribe prescription medication to me, and I would go and take it. And then, I'd come back a year later and they'd do a blood test on me and say, hey, your blood sugar's kind of high. And they prescribed some more prescription medication. And I went through this for probably 5 primary care physicians. But none of them ever mentioned to me what could happen if I didn't get my blood sugar under control, my high blood sugar under control. A1C is the test that they give you when they draw blood, and it measures the amount of sugar in your blood based on red blood cells. But none of my primary care physicians mentioned the downside to what could happen to you if you didn't get your blood sugar under control. And that's why I decided to put together this YouTube channel to kind of talk about the importance of the A1C blood sugar test. It's a test where they draw blood. It's not the finger prick test where you can check your blood sugar on a daily basis. This A1C test where they draw blood is something that they really should do if you test high for blood sugar in your high for sugar in your blood. If you test high for sugar in your blood, if your A1C is 10, 11, 12, then this is the test I'm talking about, where they draw blood from you. This is a very, very important test. It is the most important test because your A1C will determine, especially down the line, your quality of life. We're going to talk about all aspects of how important the A1C test is for someone who's a diabetic. It is the most important test you will ever take. And if you can get your A1C under control, then you technically have your diabetes under control.